If you are unsure of how your cancer treatment impacted your fertility, a really good first step is to undergo a fertility evaluation. For women or anyone with ovaries, this involves testing hormones as well as a physical exam. Often it will include a transvaginal ultrasound where they look at your uterus and your ovaries, and they will be able to count the number of follicles in your ovaries. Each follicle contains an egg, and this will give you a sense of how many eggs your body produces each month. For men or anyone with testicles, a semen analysis is the most common procedure when it comes to fertility testing and anyone trying to understand any kind of male fertility information. A reproductive endocrinologist is a fertility specialist, and they specialize in doing these types of evaluations and can provide counseling about your reproductive health and your family building options. However, seeing this type of doctor is not always covered by insurance, and it can be quite costly. So again, for anyone with ovaries, I recommend talking to your gynecologist or even a primary care doctor as a first step if you don't have insurance to see a fertility specialist. A gynecologist should be able to do both hormone testing and the ultrasound. A primary care doctor should be able to at least do the hormone testing and give you some counseling around that. For anyone with testicles, you can see a urologist for a semen analysis and counseling about your reproductive health. At any given time, your fertility will depend on a number of factors, including the cancer treatments that you received. That'll include both the type of cancer treatment and the dosing of treatments. And here I mean, with any kind of a chemotherapy agent, both the type of chemo and the dosing of the chemo. But it will also depend on what your fertility status was prior to your cancer treatment, your age, your overall health, and a number of factors. So for many people with ovaries, cancer treatments may have negatively impacted their fertility. That is, they reduce the number of eggs and increase the risk for early menopause. But it's still possible to get pregnant. It's still possible to freeze eggs at this point if you're not ready to get pregnant, but you want to in the future, and you may be at risk for early menopause. So there's lots that you can do. There's no way to really know what your chances are without knowing that personal history and your reproductive health right now, but go see either your gynecologist or a fertility specialist to have some of that testing done and get a sense of where your reproductive health is right now. So the impact of chemotherapy on your fertility will vary. It'll depend on the chemotherapy agent and the dose that you received. But again, your fertility is also connected to other factors. So it'll depend on what your fertility status was prior to cancer treatment, your age, your overall health, and other factors, your lifestyle factors. So again, to know where your fertility status is right now, your reproductive health, undergo a fertility evaluation, get that personalized information about your body and your reproductive health, see your gynecologist, see a fertility specialist to get that information, and then you'll have that answer. So the short answer is possibly. A menstrual cycle is often used as a proxy measure for fertility, but it does not equate to fertility. It's one marker that we use to tell us about your reproductive health. So for natural conception or unassisted conception, you need to ovulate. If you're not having a menstrual cycle, that means you're not ovulating. So that would be concern. See a doctor, have your fertility evaluation done. It may be that because of your cancer treatment or other health-related factors that you're not currently having a menstrual cycle, but your body can certainly be capable of having a biologically related child. That means you might have eggs inside your ovaries, but for whatever reason, there may be changes in your hormone status. For whatever reason, you are not going through the menstrual cycle, but that doesn't mean that you can't in the future. It'll just depend. Talk to your oncologist, see what is expected based on your treatment history, and undergo a fertility evaluation to see where your reproductive health is at this time, and start to track down the reason for not having a menstrual cycle. So most doctors, this is a very general statement, it's going to depend on your disease history and your treatment history and your current risk for recurrence. Most doctors are going to say they want you to wait at least 1 year, possibly longer, before you start thinking about IVF procedures or getting pregnant yourself. So you're going to have to talk to your oncologist about that risk. Now, in some circumstances, even if they have general recommendations, you may make a decision or you may talk to your doctor about the option for making an exception to any sort of a rule. What I mean by that is based on your age, based on your current reproductive health, it may be important to vary from a general recommendation and think about undergoing IVF procedures, either to collect eggs to use in the future or to get pregnant now, given your personal circumstance. So you're always going to have to weigh how your priorities align with the risks and benefits of the different options. Okay, so it's going to be a personal decision. Talk to your oncologist, talk to loved ones, and think about what matters most to you and how you're going to weigh those risks and benefits. So I think this question is about if you're taking hormone therapy, so as is the case for a woman with hormone-positive breast cancer, you're often put on a hormone-blocking medication, such as tamoxifen or an AI, and typically a woman is put on that for 5 to 10 years, or a person with ovaries and a history of breast cancer. So how do you think about family building in that case? If you cannot get pregnant when you're on hormone therapy, it can be very dangerous to the fetus and to yourself for your own health. So you cannot get pregnant, but waiting 5 to 10 years to have a child clearly interferes with family building. Talk to your doctor. There is evidence that suggests it can be absolutely safe to take a break from hormone therapy in order to either undergo an IVF procedure to retrieve eggs to either use in the future or to use with a surrogate, or to get pregnant yourself and take a break during that entire pregnancy. So you're going to have to talk to your doctor. If you're starting to think like you want multiple kids, think about that timeline. Write out that timeline. Plan ahead, knowing that it's hard to predict. Even with IVF procedures, it doesn't guarantee that you'll get pregnant the first time or even the second time. So some of these things can be hard to predict, but start to organize yourself, think through the timeline, and remember, you may always have the option to freeze eggs now, but then use them in the future.